What's the situation on the finances? Well, many times if a person has a lot of finances, well, they're not going to be able to get into the nursing home until they do what's called a spin down. So maybe it might be time for the 75-year-old mother or father to start giving their things or willing their things away to, or putting them in trusts to the grandkids, to the kids, or whoever, to their charity that they want to give things to. So that's an issue. Who does what now? Now that you're trying to come about to place, where does a person stay? What are we going to do for them? You have to get all of the family involved. So many times I get, it's usually a husband and wife situation now. The husband comes in and he'll say, well, my wife's coming down with Alzheimer's disease, and I can't get people to help me take care of her, and it's just wearing me out. They become the patient. Or it could be vice versa. Or it could be a child that's living with their loved one. If you don't take care of yourself, who's going to take care of your loved one? So in this setting, I strongly, strongly, strongly recommend that you get the whole family together. You say, we need to have a family meeting. You call them, well, so-and-so doesn't want to do anything. Such and such lives in Philadelphia. Such and such lives in California. Okay, that's all right. They can put some finances to the equation. They can help in this equation. And what you do is all these family members come together. You say, mom has Alzheimer's disease. Dad has Alzheimer's disease now. And we need to do something about that. And what can we do? Okay, we all want to keep her at home. Say that's what you decide. So it takes money to keep her at home. So those family members that can't get here, they need to get put in the books for sending X amount of dollars every month, every week to help take care of the loved ones. Maybe they buy all the depends, or maybe they buy all the insure, or maybe they buy all the particular types of whatever mom likes. And then if they can't come, maybe you have to pay somebody to come in and help. Maybe they help pay for the sitter to come in twice a week. And then those that are local, you got to really be, this is a strict part here, you got to really be strict and say, okay, Tuesday at 8 o'clock, that's Susan's time. Susan, you've got to be here to help take care of mom from 8 until the time she goes to bed. Wednesday at noon, that's John's time. John, you've got to come in Wednesday at noon to help take care of dad until he goes time to go to bed. And when they come in, the main caretaker, you need to leave. You need to leave and go out and get some fresh air, go out and do some of the things you need to do. So you have to have people that you trust coming in to help with your loved one so that you can leave. When they get there, you need to leave and go another location. Because, again, I've told you, one of the bad things that happens with the caregivers is they take it all upon themselves. All upon themselves. And what happens over time is they get sick. They get depressed, they get down, they don't take care of their diabetes, their hypertension like they should, and they end up being sick. Now who's going to take care of the loved one? Very, very, very important as you do that. Get some help. Do not try to do it on your own. This is such a big problem when caregivers are starting out taking care of their loved one. They say, I can handle it, I can handle it. No, you can't handle it. Get help. Start it out immediately. Start it out in the very beginning so that everybody's on board and you can go down this hill together.